How seniors can finally overcome the burden of phlegm. Understanding causes and safe remedies. As we grow older, many of us notice that a small but persistent annoyance starts to accompany daily life. Phlegm stuck in the throat. For some seniors, this problem is mild, just a minor irritation in the morning. For others, it can become a daily struggle, making it hard to speak, sleep, or even enjoy a meal. Elderly people often describe waking up every morning with mucus in the throat, coughing and spitting, leaving them tired and uncomfortable. Some complain of restless nights, frequent throat clearing, and even embarrassment in public because of the constant need to cough. This article is written specifically for seniors and their families. It will help you understand why phlegm appears more often in older adults, recognize the most common causes and symptoms, learn simple, safe, and practical home remedies. Know when it's time to seek medical help. The goal is to give you the tools to reduce phlegm, breathe easier, and live your golden years with more comfort, energy, and joy. 1. Why does phlegm become more common with age? As we age, the body naturally experiences a decline in function. The digestive system, respiratory tract, and immune system are not as strong as they used to be. This makes the throat and lungs more sensitive and prone to producing excess mucus. Key reasons. Phlegm is more common in seniors. Weakened esophageal valve. Stomach acid can flow backward into the throat, irritating the lining and creating more mucus. Weakened immune system makes it easier to catch infections like bronchitis or sinusitis. Long-term lifestyle habits. Smoking, heavy drinking, fatty foods, late-night meals, or long-term use of antacids. Chronic conditions. Diabetes, heart disease, or COPD. Chronic obstructive pulmonary disease. This means that phlegm should not be ignored in older adults. It is often a signal that the body needs care and attention. 2. The most common causes of phlegm in seniors. A. Acid reflux, GERD, one of the leading culprits. When stomach acid refluxes upward, it irritates the throat and causes mucus buildup. Symptoms: morning hoarseness and sticky mucus. Frequent throat clearing, especially at night. Burning sensation or sour taste in the mouth. B. Respiratory infections and sinus problems. Sinus infections and post-nasal drip are common in seniors. When mucus from the nose or sinuses drips down the back of the throat, it feels like constant phlegm. Signs: yellow or green mucus, infection, stuffy nose, facial pressure, coughing at night. C. Allergies. Dust, pollen, pet dander, or even certain foods can trigger allergic reactions. Seniors often have weaker mucosal barriers, so allergic phlegm can be persistent. D. Smoking and secondhand smoke. Many older men, in particular, smoked for decades. Tobacco irritates the lungs and creates chronic mucus production. Even after quitting, phlegm can remain due to long-term lung damage. 3. Safe and effective home remedies. A. Adjust diet and lifestyle. Eat light, easily digestible foods. Avoid fried, greasy, spicy, and acidic meals. Do not eat late at night. Finish dinner 2 to 3 hours before sleep. Drink plenty of warm water. Avoid cold drinks and ice. Reduce alcohol, coffee, and completely quit smoking. B. Cleanse the nose and throat, gargle, and rinse daily with saline solution. Use a neti pot or nasal spray with properly prepared saline, 1/2 teaspoon salt plus 1/2 teaspoon baking soda in 2 cups boiled and cooled water. For more severe infections, under doctor's guidance, diluted povidone iodine solution may be used for gargling. C. Improve living environment. Keep the home free of smoke and dust. Use an air purifier if possible. Keep windows open for fresh air and sunlight. D. Gentle exercises for seniors. Deep breathing exercises. Slowly inhale through the nose, exhale longer through the mouth. Repeat 5 to 10 minutes daily. Light physical activity. Walking, tai chi, yoga for seniors. Sleep posture. Elevate the head with a pillow to reduce nighttime reflux. E. Helpful traditional remedies. Warm ginger tea with honey for soothing the throat and thinning mucus. Steam inhalation with eucalyptus leaves or menthol oil. Apple cider vinegar diluted in warm water, only with doctor's approval if stomach problems exist. 4. When should seniors see a doctor? Phlegm can usually be managed at home, but certain warning signs require medical attention. Phlegm with blood. Phlegm lasting over 3 weeks without improvement, shortness of breath. Chest tightness, wheezing. Unexplained weight loss or fatigue. Chest pain or coughing up large amounts of blood. These may indicate serious conditions like COPD, lung cancer, tuberculosis, or heart complications. Seniors should never ignore these red flags. 5. Key advice for seniors. Treat phlegm as a warning sign, not just a nuisance. Maintain a balanced, senior-friendly diet. Exercise gently but regularly. Practice daily nasal and throat hygiene. Go for regular medical checkups. Stay positive and reduce stress. Mental well-being directly strengthens the immune system. Conclusion. Phlegm is not a disease itself, but a symptom of underlying health issues. In older adults, it is common due to natural aging and chronic conditions. With consistent lifestyle adjustments, healthy eating, hydration, gentle exercise, and proper hygiene, seniors can significantly reduce mucus buildup. Most importantly, do not ignore persistent symptoms. Early diagnosis and treatment can prevent complications and allow seniors to enjoy life with ease, dignity, and peace. By taking these steps, older adults can say goodbye to the daily struggle with phlegm and embrace their later years with comfort, confidence, and joy.